Good morning and welcome to the next Grow Your Business in South Miami. My name is Kenneth Wright and I am on the board of directors of the South-Dade Chamber of Commerce. And of course, I am the health insurance savant as well. And today we have with us two of the professionals, the owner actually, and the lead medical professional at Manny Specialty Center. So I'd like to welcome you both here today. Steve Taylor and Diana Centeno.
Good morning.
Good morning.
Okay. So I want to start off really with the question I had, which was when I saw Manny Specialty Center, I was unsure of what you guys did. So tell me a little bit about what you do at the Manny Specialty Center.
Manny Specialty Center. Good morning. Manny Specialty Center is a link with Miami-Dade County regarding survey of STD and HIV in our community. And what we do also linkage to care. So once we do our survey, they come into our office, we check to make sure, and also we do what we call a diagnostic, blood work, lab work. And once we find out that these patient is a candidate for possible HIV, STD, then we report it to the health department. And the health department then reply to us according to the discovery.
Okay. So how did you get involved in this business?
We get involved in this business because we communicate with Dade County Department of Health. They have so many in the community that they're not able to handle the amount. Because Dade County has the most HIV, STD in the community. The location we at now is an underserved community. So therefore, they give us the assignment for that particular location.
Oh, hang on. So you're saying that this service is already being provided by the community,
Yes,
but there are certain places that they can't reach, and those are the places that you've then been assigned to handle the overload, basically, that they can't handle.
correct.
Ah, that's really interesting. So but then the question still is, how did you decide to get involved in this
I decided personally because I was in another location and I realized the needs, are plenty. And I realized if we could treat other community, because we actually have another center in the North Miami, Miami Gardens area, and there were so many people coming in, and we reach out to Department of Health. Hey, there are other community that we can do it, and they say, yeah, go ahead and do it because there are areas that people don't even know that you can test for these type of sexual transmitted disease. They're not aware of it. And one of the things that we learn in our community is that no information, people will not do things that are necessary for their benefit. And one of the things that we try to reach out the community, educate them is know your health status.
Right.
A lot of people don't know their health status. Some of them do know, but because of stigma, they fail to let the right department or division know.
Right.
And
the stigma question, that's something that I think, Diana, you deal with all the time, right?
Yes, actually, I do. Especially down where we're at in Homestead, everything is negative about any STDs, HIV. It's looked at, it's frowned upon. Actually, it's seen as something that it's dirty. I can't get it. It's only for certain type of groups. So it's hard for me to actually reach out to the community and tell them, hey, listen, get your status. It's always good to know your status. There's STDs, most of them you will never even know that you have them.
Like which ones do you not know that you have?
Chlamydia is one of them. 70% of women will have it and will never know because we women go through our stages in life, our hormones change. And so a vaginal discharge will be normal for us in reality.
What do you do for something like chlamydia?
Well, I will screen them, and if they do come back positive, then I will test. I would treat them with just pretty much right now it's 2 pills, which is azithromycin.
Really?
Yes.
And it's done?
And pretty much it's done. You take 2 pills. I normally bring them back to the practice in 3 weeks, and I recheck them just to confirm that it is completely eradicated.
Right.
Sometimes I do get cases that I have to treat them twice.
Right.
And then that's it, pretty much.
Chlamydia is number one.
Chlamydia is number one.
And what is like Number two.
The number 2, I would say syphilis. Number 3 would be gonorrhea.
Wow. So it's really what's really interesting is that these are things that I've seen. I think the Miami-Dade County billboards for gonorrhea,
Hmm.
but syphilis is something that I mean I would thought that it was basically eradicated.
Well, that's what we thought too, but it's
Okay.
not.
It was so that was something that was it was a common thought for a while.
Yes, yes. Actually, at one point, we had monkeypox come up, around, and
We have no monkeys.
Well, no, we don't have monkeys, but we did have at one point, the monkeypox breakout, and
Stay away from monkey jungle is what you're saying.
well. If it was that easy, but it was something that was new, and it did kind of mimic a lot of syphilis.
Oh, really?
Yeah, it did kind of look a lot like it. So when we were, my patients would come in, I would automatically kind of screen them because it was at a point that I couldn't just say, yes, it is syphilis, and we'll go ahead and treat you for that. No. At one point, I was like, no, everybody's going to go ahead and get cultured, and that's it.
Wow. And again, I know that you really put an emphasis also, as you've mentioned before to me, Steve, is on HIV.
Yes.
That is one of your primary concerns, I guess you'll say, in the community, right?
Yes, it is actually one of my concerns because we are in Miami-Dade number 1 as HIV risks and cases.
Number 1 where?
In Miami-Dade County.
And where? Compared to what? Number
Compared to any county in the state of Florida. We have the
in
highest
Florida,
numbers.
we're number 1 county in the state of
Yes,
Florida.
and Florida is number 3 in the country.
Wow.
Yes. So if you see the numbers, I mean, you can go
and again,
into
that's another thing where I think a lot of people are under the impression that HIV is no longer a problem and no longer spreading.
Correct. Yes, I do get that. And like I said, patients tell me, oh, there's no way that we can be number 1 because patients look healthy. Patients look healthy with HIV nowadays. They don't look sick. They don't look emaciated. They don't look that way.
And why is that?
The person's actual body, how they deal with it. It all depends on the person. So, and then there's some patients that really don't disclose that they have HIV.
Right.
I've had several cases with that because either they feel ashamed or they're scared.
Right.
So
I think that I may have been exposed to HIV. So what do I do?
if you come to my center and you come to me and it's been before 72 hours, there is a treatment called PEP. It's a post-exposure prophylaxis. And what I can do is I can actually give you a treatment for 28 days.
So that's really important to know, right?
Yes.
Is if somebody thinks that something might have happened, don't wait.
Don't wait.
Go to Manny Specialty Center. There is one in North Miami Beach, and there's one in Homestead. Or you can contact the county, and they will direct you to a place that might be able to help you.
Yes.
Right?
Yes.
And do it right away. Don't wait because you have a 72-hour window of where the virus will most likely not be able to
Multiply.
Mm-hmm. Wow. I don't think that's really, really important information.
Yes.
Okay. So, Steve, this is a big deal.
Yes.
Right? This is like you've taken upon yourself like a real important part of providing a public health service to the community.
Yes.
So I'm going to ask you again, how did you decide to do this? In the bigger sense, not that you saw that there was a need, but what about you has drawn you to providing these kinds of services?
Well, I was involved in cancer research before, and I noticed that a lot of people, when they have any type of disease and you said, okay, I want you to do a test, for me. And then when we find out these different type of virus, we realize that the needs are very high. And what we did, we went ahead and said, you know what, let's do a research and see what we can do to find out how can we help these people, and then that's when we reach out to the community. One, I loved it because the research previous in the medical field, I loved it because when I see that I can help people, educate people, let them understand. And these are some of the people we basically targeted. We target anywhere from 13 to 65. Why those ages? Anywhere from 21 and up. They're in denial. They went to a party the night before. They don't know, hey, what happened? They became involved with different partners. People with needles, especially with those who take drug needles. So I get involved with it because I say, I want the people to understand. Disease is something that's spread and you are unaware of it. And I get involved with it. I love it because then if I could save one person or educate one person about the disease that they're not aware of, and that's why I could become involved with it because I loved it.
Okay, great. Yeah. And you're providing an incredible service
Yes.
to the community. Like I said, is that we're with Steve Taylor and Diana Centeno, who are the CEO and the main medical person, I guess,
Yes.
medical director.
Well, I'm the actual nurse practitioner there.
Right,
So-
whatever it is.
Yeah, so pretty much, yeah.
Yeah,
I
like
kind
the
of look over the medical part.
boss, right?
There you go.
You're the medical boss
Yes.
there for Manny Specialty Center. I do want to ask Steve a question, which is something we talked about yesterday, which is where did Manny Medical Center, where does Manny come from?
That's a very good question. Many medical question came from, I use my granddaughter name. You know, when I was trying to come up with a name, I said, well, either medical center name or somebody who I love, somebody who I trust. And I say, I need somebody who's unique, who can think properly. And the first thing comes to my mind, my granddaughter,
Right.
So, and then we just shorten it and name Manny. So
And
that's what.
In Manny Specialty Center, right? That's what it's called. And the other question I asked is why specialty? And there's a reason for this, right?
Correct. And as the doctor said before, nurse practitioner said before, the reason why there's specialty, when you're looking for, if you go on the website and you say, hey, I think I did something wrong and I want to check anything go wrong, they look specifically, HIV, STD, or I think there's another common word that they use, and that's really good specialty. The hospital, especially, somebody come in, diagnose, they find out, hey, they got HIV or STD. They want a linkage to care. So they want to know where to send them, that this particular center will cater to their needs. And that's why Manny Specialty Center is there for that purpose and reason.
Right. Now, I know that besides doing the specialty care, you also do provide another service,
Yes.
and that is
Primary care.
primary care.
Hmm.
But if I'm looking for primary care, I don't come to you.
Well, I mean, I am a provider for several insurance companies. So if, let's say, for example, Oscar is one of my special insurance companies, and there's a patient that looks me up on the provider portal. They call my office and they say, well, do you provide primary care? I will not turn them away.
Oh,
I will
okay.
definitely say, well, yeah, we can see you for primary care. When they do come into the center, if they ask, hey, listen, what other services do you have? Then, of course, we will let them know.
Right, but
as
that's
well.
not why you started offering primary care for people to come in off the street,
No,
right?
no.
So talk about that. Why did you start offering primary care?
Because let me tell you, I had patients that would come to me for STD and HIV. And then, for example, they would have their blood pressure super high when they would come in. It could be a nervous thing, and I would ask them,
Yeah,
hey,
a lot of
listen.
people are nervous when they come to get
Right.
tested for this stuff, right?
So,
I would say so.
I would tell them, listen, your blood pressure is a little high today. It could be your nerve, that you're nervous. We'll go ahead and, kind of check it again in a couple of minutes or whatever. And then I would say, do you have a primary care, that maybe they can go ahead and follow up with you regarding your blood pressure. And then they'll tell me, well, I don't have a primary care. So can you kind of help me out with that? And that's when I'm like, okay, well, yeah, no problem. I'll go ahead and I'll see you next visit, see how you're doing with your blood pressure. So then I started noticing that as I see things with patients, I tell them, hey, listen, if you don't have a primary, I can go ahead and take care of that as well. And patients really like that. They're like, wow, I can kind of do everything under the roof. Yeah.
Right, and that makes sense because these are people who don't have that relationship,
Right.
and to have it is one of the more critical relationships that people should have. And
Right.
I'm always shocked by people that don't have a primary care doctor. So any way that they can, primary care physician or caregiver, any way that they can develop that is a real service.
Yeah, and
as
I feel
well.
that they like it. They come to me, and anytime anything comes up, a cold or anything like that, they can come see me. So it kind of builds a bond between us. It's not just for the STD and HIV aspect, but then we also have the primary care. So
Right. So, we're here with the, Miami-Dade Chamber of Commerce, right? So the question I always like to ask people is, one of the things that the chamber is about is helping businesses grow and develop and become successful within the community. It adds value to the community. It adds dollars to the community. It helps with, hiring people in the community. So what can the chamber do for you to help you continue your outreach and your growth of your business?
Continue to promote what we do. That's number one. And then number two, continue that the community be aware that the service is there in their community. And the Chamber of Commerce can help us that the community can, whatever your needs are. Because some people say, well, I'm not going in because I don't know how much it's going to cost me. We still help you regardless. That's one of the main things some of the community doesn't have. They say,
So there's no cost.
so there's no cost in some area. There are limited costs in some area, but some area don't know cost. Example, you walk in our center, you say, you know what, I need to get tested, but I don't have the finance. And we look in area or resource that we can help you because we want to make sure you get tested.
That's something that, again, that's a critically important thing for people to know, for people that are uninsured or they aren't sure about their insurance. And my working in the health insurance business, I'll tell you that most people have no idea what their insurance will or won't cover.
Correct.
And the biggest fear a lot of people have is that this is going to cost me a lot of money, and they don't seek healthcare, number one, because of the stigma, maybe, right? And number two, because they're afraid that they can't afford it.
right.
Correct.
Right.
That's
So
correct.
there are a lot of reasons people don't choose to come to a facility like yours that could really help them.
Right.
So that's good for people to know that regardless of your financial situation, regardless of whether you have insurance or don't have insurance, go to Manny Specialty Center because they will make sure that you receive the services that you need, either at a cost that's part of your insurance or that is very affordable if there's any cost at all. Is that
Correct.
is that okay
Correct.
to say?
Yes.
Yes. That's correct.
Okay, that's
Yeah.
great.
And the Chamber of Commerce is one of those that we find in Dade County when we were seeking out, assistance to let the community know that we're there. We actually went to Homestead Commission Department and we went in a meeting. And when we presented ourselves to them, they say, hey, this is a program that the community would be interested in. And that's when I reach out to the Chamber of Commerce, South-Dade Chamber of Commerce, if I'm saying it right.
You are the South-Dade Chamber of Commerce. Don't worry about it. There are so many of them, right?
Okay, that's right, exactly.
I want to make sure you're saying the right one. Yeah.
And that's when I reach out. And I hope to develop a better relationship with the Chamber of Commerce because I observe a lot of other community around there that they're also interested in what we do, which in other doctor office, and even some business to business. And the Chamber of Commerce is what link us together.
That's right.
Yeah, because I would say fairly new because we started on November of 2021.
Mhm.
So we wanted to let the community know that we're there. Hospital, doctor's office, people who seek us from different areas, people who's not aware that we're there.
Mhm.
And this is where the Chamber of Commerce help us to promote those things.
Okay.
Yeah.
Great. Well, we have a big event coming up on February 19th. Don't hold me to that, but I believe it's February 19th, called the State of South Florida,
Okay.
where we're going to have all the elected officials, not all of them, but a good number of the elected officials from South Florida, from Cutler Bay on down, mayors of the different communities, Pinecrest, Palmetto Bay, Cutler Bay, and they're going to come together and explain what's going on in their community
Okay.
and what kind of projects are happening, what kind of developmental things are happening. And it would be a great place for you to learn about what's going on and where you can plug into these different communities and what your services could be.
Okay.
So that's the kind of thing that we're doing at the chamber to help achieve exactly what you're asking.
Okay.
Because it's important to know what's going on in the halls of government, right? So, because they're the ones that really help determine a lot of how businesses grow or don't grow.
Right. Right. Yeah. Well, some of the government, what I noticed, and especially the state of Florida, they want to do things that it doesn't cost them expense in the long run. That's the reason why some of them do it. And I appreciate that, because in the past, a lot of the patient used to go to Dade County and in downtown, basically. And it was costing the county more money to have all these people come down there, and they come together and say, wait a minute, why don't we let the nurse practitioner handle some of the workload? And they enjoyed that the most.
Yeah, I mean, that makes so much sense, right? Because there are places that are higher cost centers than others.
Yeah.
And if you're providing a service at a lower cost, that's what's important. So, Diane, I want to give you a chance. Is there anything you want to say to the community about what you do and what you're doing that can, maybe inspire them or get them thinking?
Well, my main goal right now is to get the community to come over and get their status, not be afraid. We're there for them. When it comes to cost, like Mr. Steve had mentioned, we do work with the community when there's different programs out there that we can get them on, to the point that their medication is paid for, their cost with me is paid for, their labs are paid for, so my goal right now is to bring awareness, education especially, because not everybody knows about HIV and how it's transmitted, how easily it can be transmitted. And it's not just specific groups. So my goal is just come on over, let me talk to you, let me counsel you,
When I leave, do I get a sucker?
Yes, you definitely do. Not only that, let me tell you another thing. We
What?
are a condom distributor for the Florida Health Department.
Oh, I did see
So,
that.
yes, so we do give free condoms to all our patients.
I think that's something that a lot of
Yes.
people are interested in.
Yes, we do give that, and whoever comes in, we always tell them, hey, listen, we do give, with
Are there
everybody
different
leaves
colors?
shapes, taste, whatever you want. Yes,
Optional size.
they're available for everybody. So we do tell patients that come in, hey, please let your partners know, friends know we're here, and there's never a reason why you cannot have a condom or at least get tested here.
This has been really informative, and as someone who, I have an undergraduate degree in medical technology, as someone who really thinks that he has his finger on the pulse of medical needs in the country, this is something that really opened my eyes to something. Like I said, I thought that a lot of these things weren't a problem anymore, and so just the idea that for me to have learned these things, I know they must be providing that same kind of education to everyone else that's out there. So thank you so much, Steve. Thank you so much, Diana.
No problem. Thank you for having us
being
here
today
Yes.
and providing this critically important information, as well as talking about your business.
Yes,
Thank you very much.
Okay, take care.
Okay.
We'll see you again at the state of South-Dade.
Yes.
Okay.
Yes, thank you.